Hi everyone, welcome to this Facebook and YouTube Live, which is Patient Voice for Modality Birmingham Division. I'm really excited to be joined by Maxine and Sushil from Birmingham, and then we'll have a couple of other faces that might appear to run through some slides and answer some questions as well. I'm going to hand over to Maxine to start off with. I will share the slides and Maxine and Sushil will introduce themselves. Just 2 seconds for the slides. There we go.
Okay, good evening everybody. Thank you to for joining our second patient voice group. My name is Maxine Rowley and I'm the Divisional Service Delivery Manager for Modality Birmingham. And if I hand over to Sushil.
Hi, good evening. My name is Sushil Randawa. I'm one of the GPs from Hansard Wood Surgery. I'm a partner there, and I'm also the clinical lead for the Women's Health Clinic here in Modality. Thank you.
Okay, so we're just going to go through a few housekeeping rules so that everyone has an opportunity to join in this session. There'll be an opportunity for a Q&A session at the end. We will start collating them and then we'll go through them with everybody. The session is being recorded so that we can share it on practice websites and our social media pages. Next slide, please. So I'm just going to refresh from an update on why we're doing our patient voice. This is the old PPG, and we really want to have everyone involved and have an opportunity to share their thoughts and feedback across our different sites and services. It's open to everyone that's registered at one of our sites in Modality Birmingham, and that includes Modality Partnership, includes Modality Birmingham, which is Laurie Pike, Handsworth Wood and Enki combined, Bellevue, Black Country Family Practice, and Hillcrest and Murfield and Smethwick. And you're automatically members of our PPG and entitled to come and join our patient voice groups. It's also open to carers of patients as well. So if you do want your carers to join these events, you are more than welcome to forward invites or ensure that their contact details are available to us so that we can share any future events with you. It's not open to people that are not registered with our site. So, and it's also a non-political group as well. It's very much about our services and how we gather your feedback. We want to work together on patient surveys, provide education support and share our knowledge of local services, things like winter pressure, flu, vaccinations, other adult and childhood immunisations. We're also working with other practices within PCNs and within our sites to deliver things like respiratory clinics and other health services and wellbeing opportunities so that you can have best care and services available to you. And they do change from time to time. So being part of this allows you to be part of in the know about what's going on locally for your patients, your colleagues and your services. We are doing the virtual meetings once a quarter, and also we will do one community event in the year, and we are looking to set these up and arrange these locally at all the sites for June 26. Further information will follow. Next slide, please. So, what do we mean by digital health? It allows you to access lots of services quickly, and also the main app in use is the NHS app, because it allows you to see your records and access things to make it easier for ordering your repeat prescriptions. It gives you access to secondary care invites and other community services. They're all using it. And also we use things for informing you of different services available and appointments, and maybe to gather some health information for you, such as respiratory questionnaires, immunisation questionnaires, cytology questionnaires we've recently sent out, and it allows us to gather your feedback so that we can continue to improve our services. We also send out SMS and appointment reminders from clinical systems to kind of keep you in the know. I think one of the most important things also is that we do monthly access questionnaires. So if you have had an appointment at one of our services within the last 3 months, we send you out a short questionnaire, which helps us to gather feedback to how we can improve our access and ensure that we are reaching everybody with information about all of our services available. We're not online for everyone to receive automatic text messages for your appointments, but we are almost there. So in the next few weeks, that definitely should be live for every service. And at this point, I'm going to introduce you and hand over to Abigail Blewett, who is one of our managers.
Hi everyone, so I am the practice manager at Hillcrest Surgery. So I'm just going to talk to you about digital services that are available around our practices and within our practices as well. So let me just get my slide up. Okay, so there are some digital inclusion centres which are free for patients. These are based all around Birmingham, Black Country and Smethwick. I've got some typical support that they include are learning how to use the internet, getting help setting up an email or the NHS app, as we have a lot of patients that do struggle with the NHS app. They do guidance on booking GP appointments online, helping accessing health services or benefits for online as well. They've got free Wi-Fi, computers and mobile data in some of the centres. Next one is, so we've got a couple of examples that are here. So any libraries in and around Birmingham, Black Country and Smethwick, community centres. There's charities such as Lynch Trust and local faith organisations. Your GP practices can signpost you directly to them, or you can self-refer, which I have got a link for, which will be shared. We've also got social prescribing through the GP practices. So within Hillcrest, we're part of GOS PCN. We have a social prescriber that comes in to do drop-in sessions. She's also available for booking appointments via the GPs. We do referrals. They also can help with some of the digital side as well. So they do digital skill classes, community IT drop-in sessions. They have support groups as well for older adults that have learning difficulties and aren't able to access the internet. They are, again, within Birmingham and Solihull. Not too sure about Black Country and Smethwick, but I will find that out. Then we've got voluntary and community sector as well. So you've got the Birmingham Voluntary Service Council, which also supports digital inclusion projects. You've got community organisations that run digital skill workshops, device loans and support for vulnerable residents. And then also you have the Birmingham City Council and the Solihull Council, who also support digital inclusion. They provide community training sessions, digital champions in libraries and community hubs, which, speaking of digital champions, we do have one at each of our modality sites now, who are able to help you with the NHS app, any queries that you have. They are there to support you. We've also got libraries in and around Birmingham that do hubs as well. This is, again, support available, which is helping using the internet, emails, assistance with NHS app. They've obviously got your free computers and Wi-Fi access for you to book appointments, view your online records, etc. Then we've got neighbourhood network schemes as well. So these are, again, across Birmingham. You've got a Northfield hub that's available. I have got all websites and phone numbers provided as well on here if anybody's interested. They provide digital training sessions, advice on getting free or low cost devices and the internet, and again, support for older people or people with disabilities. There's 10 in Birmingham of them who work closely with social prescribers and community organisations as well. And there is also community digital training centres which are available. I have an example, which is Norton Hall Children and Family Centre, again offering one-to-one IT support, help creating emails, basic computer courses, and this is all free to patients. I would recommend looking into it if you do struggle with using the internet, etc. They have really good support hubs around, and again, all of the details are in this Word document, which we can share. There's also a self-referring link, which I'm sure will be shared as well on here, which you can just self-refer yourself through. You don't need to go through your GP, and they can offer any support that you'll need. And that's pretty much it from me, I think.
That's great, Abigail. That's really good. I think it just says that there's a lot of access points out there. If you do need any information around this, these digital support outside of and in the community, these are available from our GP practices, and we will add some of the information to the website, so they'll be available there as well. Just obviously, we really are pushing the NHS app, and it's not just for us, it's actually where all of your information goes, and it joins up primary, community and secondary care. That's really important. If the system online access is our patient online service, that's still there, that's not going away. So again, if that's how you access any of your records or order your repeat prescriptions, that's still there. Rapid Health is our online triage system, and so all the links are available on the website, how you access that to put in a request, a medical request or an admin request, and I'm hoping that Sushil can give a viewpoint on that from from a GP perspective. The beauty of Rapid Health is should you answer all of the questions, if it deems suitable, it will take you to available appointments so you can book, and that's available. If you don't have internet or anyone that can help you with it, all of our staff will also be able to help you with that. Voice Connect is a telephone repeat prescription service. You do have to be set up once. If you don't have a PIN number for that already, please contact any of our sites and they will, where you're registered, should I add, but they will also be able to provide you with the login details. And then another digital software that we use is AccuRx, and we do contact a lot of patients with that, not just for messages around their appointments, but communication with GPs as well. Sushil, would you like to add anything else in there around Rapid Health before I move on?
Yeah, Maxine, thank you. It is really helpful if Rapid Health is answered accurately, because as a GP, what happens is the first thing, whoever's on call comes in, logs in. We are looking at all the information that's provided. And sometimes I realize it's difficult to put everything in, but if you could put the gist, the important factors in, and sometimes, I pick up the phone and I say, I'm quite concerned about you because of what you put in this in Rapid Health. And then actually it turns out that that was not what the patient wanted. So if you could give the right information, either I could immediately do a prescription, or you could get booked in, depending. And the beauty of it is, we don't need to now sit on the phone like we did every day at 8 a.m. and then waiting number 50 or 60 on. Now, whatever time you can log in, put in your details. And I know, being a mom myself, sometimes I don't have the time to wait on a phone. So filling up a form does make it easier. And then I can get offered an appointment when it suits me as well, because we get an option to pick. So, and I understand, some people find it difficult to fill up the form. And as Maxine mentioned, we are there to help. It's not meant to be a hindrance. It's meant to help you to get the right access. So what I'm trying to say is, put the right information in, you'll get the right access and also the right help at the right time. Thank you.
Thank you. Next slide, please. So we're just moving on to this. This slide actually gives a bit of a landscape around how digital services are moving across any part of healthcare now, and it kind of like it's moving quite rapidly at times. So it's quite simplified about how, whether it's in the community, GP practice, secondary care, it's all different services there, and apps that are now being offered out for physiotherapy support, well-being, mental health. Lots of those apps are out there. So this just summarises that. Interestingly for us, Rapid Health is also now linked to your NHS app. So if you do have an NHS app, you can use it. You can access it via that. You do still have to use your email address, but that is coming soon, where it will just be also, you'll be able to use your mobile phone. So there'll be text messages and things coming on there. Across our division, which covers 2 ICBs, Black Country and Birmingham Solihull. In Black Country, we have about 57% of our patients that are registered with the NHS app. They do have, for Black Country and Smethwick, they do have a guy called Scott, who is very helpful. And I know that he has appointments available. So if you need any help with any aspects of digital health, an appointment can be made with him. In BSOL, we are slowly getting off the ground our digital champions, but all of our staff are trained to help you and work with you. So if you do go in, there is free NHS Wi-Fi available in our sites, and our staff can help you go through and set all of that information up for you. Interestingly, across the country, the national average is about 71%, but it is growing and increasingly moving on for how health communicates with patients through the NHS app. So this just gives you a snapshot. We know for some people, digital health is never going to be the solution or the accessible point. And we're here to help those that can't do that. So for those people that can do it, it's quick, it's easy, and it works. For those that need that additional help, whether it be on the phone or at site, our staff are there to help you as well. Next slide, please. Sushil, are you going to do that?
Thank you. Okay. So going back to digital, and as Maxine's talked about the NHS app. So as a point of a doctor who works both in primary and secondary care, it definitely is helpful. Your information is on your app. And I was just listening that day, I think West Treating was saying that the NHS app is actually the most downloaded app there is in the country. And there are many reasons for it. Not just you can request your prescriptions, and, again, speaking from personal experience, it's just you open your app, you request it. Again, no need for phone calls, no need for logging in anywhere else. So it really helps in that aspect. results come directly to the app now. For example, cervical screening, the results, they're meant to come to your app. If there's any abnormality, you might get a letter as well, but the app is the main source of information. All your results, for example, if a scan is requested, your blood test, everything again goes on there. So what we are trying to advise patients who find it easy, we all use apps all the time. Again, for those who can't, there's always help in the surgery, as Maxine mentioned. But for those of us who can, your results are right there. You just log in and look at the right tab, and the information is there. I had a recent blood test, my cholesterol levels, yes, that's normal, that's acceptable, or we might say book an appointment to speak to your doctor. So again, faster access to the practice, your repeat prescriptions, results, you're not needing to wait on the phone. A lot of us are rushing from place to place, and the last thing you want to do is be sitting on the phone for hours or trying to get through to someone. Your app is right there. Sometimes I find patients come when I'm doing a secondary care clinic in the hospital. They come to me and say, I have my results with me, and they show me the app. That is actually also very helpful. So looking at it from both sides, you have your information with you. So it's like I said, access to medical care, your records helps. It's more convenient for those of us who use it regularly, and also it helps the practice prioritize. So if, for example, if someone needs to be seen urgently, again, we can do that, whether it's through Rapid Health or via the app. Next slide, please. So, again, this is meant to be supporting and to help it. So the idea of introducing digital is, again, not to be a hindrance. We agree that sometimes it may be difficult, but most of us do have smartphones. There are a few who don't. So for those of you who don't, there's always an option to call in. You can always drop in, and we are there to help. That is the whole idea. But the difference is not everyone needs an appointment immediately. Not everyone wants to be seen immediately. So the idea is for those who actually do need to be seen urgently, those people can be seen urgently, and those who can wait for a week or two for various reasons. Sometimes you call a patient and say, can you come in now? And they're actually, can I come in 2 days' time? So you are given those options to book the appointment. But for those who are uncomfortable to use the online system, as I mentioned again, come into the surgery, talk to us. There are digital champions. We are there to help at the end of the day. And, as Maxine mentioned as well, the surgery, we're there to support with the Wi-Fi as well. And for those who prefer to have a phone appointment, they have that option. For those who want a face-to-face contact as well. So that is one of the reasons why we have options of face-to-face contact and telephone contact. Everyone is different. Sometimes you just want to have a quick chat about a result. Sometimes you actually want to sit down and meet a person. You need to be examined, and that's why we offer both of the options of the appointments as well. Next slide, please. So as we mentioned earlier, we are here to help. So for those of you who are struggling to set up the NHS app, I know initially to start off, it may seem a bit difficult, but once you're on it, it is actually quite amazing. We are there to help you. The reception team is there, and we speak various languages. We have the option of having interpreters, whether it's through language line. So, there's always the option there. In regards to repeat prescriptions, again, you can order this online or via the website, and that option is always there. And, we are constantly having digital support events for everyone that need the support to help empower you to be able to do this yourself. And, again, the whole idea is to give everyone an option of, rather than saying, everyone, you just do this. And, we all are given different options. So those who want to go online can go online. Those who want to have a telephone conversation, those who need to be seen face to face, everyone has the option there. So the idea is for us to be flexible and to work with, everyone is busy. We all need the different options really with our day-to-day life. Next slide, please. And Maxine, do you want to take this one? Thank you.
Yeah, I'll take this one. Okay, so your feedback is really important to us. Okay, we're here promoting all the digital apps and services that we have and how digitalisation is an important part of healthcare. We do know that the NHS app, as we've mentioned, is one of the highest downloaded apps, and we want to help you use it. We want to make sure that we can improve areas of access, and especially around areas of repeat prescriptions. So, and this is such a smooth process if you do it through the online services. But also we are working with community pharmacists to ensure that our processes for getting your medication to them and out to you as soon as possible works really well. So they are also helping us to promote the NHS app. Also, if you want to use or still use the System 1 online access patient online services, that's fine as well. And also we've given them some information about Voice Connect and how they can help to promote that for those people that need to do their repeat prescriptions over the phone. A big feature that we've launched in the last month is that following feedback from our access questionnaires, we now have a general inquiries line that's open Monday to Friday. It's open between 11 and 2. It's managed by a team of people, and I think at the in the last month they've done over 2,000 calls, so they've supported a lot of people, and they are also well versed in promoting the NHS app and all our other digital services that we use and how to get them through. It is not aligned for booking an appointment. It is for general inquiries, and the team there are trained in that, and they may divert you back to redial the main phone to put you through to the appointments line if that's what you need. You can also send feedback to us as well, and it's available on all of our websites. It's under feedback, complaints and concerns. We want to work with you. We process complaints as quickly as possible, and we do pick up the phone and speak to you about all general concerns, and that does help us to improve our services. Next slide, please. So what happens next? We will review all of our feedback that we get from patients. We review it monthly. It goes to various different areas of our teams at site, at some of the divisional meetings, and it really helps us, like I said on my previous slide, to redesign and offer improvements. General inquiries being one of them, repeat prescriptions being another. So it's really important that you do give your feedback. If you don't have access to be able to do this online, please don't hesitate to drop a note into the surgery. It will get fed back in to all of the feedback for consideration to help us to really continue to improve access and services and self-care, and all the things that are important for looking after you. And also, if there are particular areas that we can't address, but they are social concerns that you have, then we will reach out to our social prescribers. There's a social prescriber connected to every single site, and we will make sure that you are connected. They have wider outreach into the communities and signposting. They have face-to-face, they have online appointments, telephone calls. So we will really promote that for you and make sure that event, that feedback is taken care of and that you are looked after. Next slide, please. So this is our second patient voice meeting. Our next quarterly meeting will be at sites over June and July. We will, if they can't be at a site because the surgery might be too small and not have a room available, we will make sure it's at a venue local to your site, and it will be some that we group together. For example, Handsworth Wood, Laurie Pike and Enki, they will go as one event, but it will be face to face. We will make sure that all the invites are out well in advance. We'll let you know who's going to be there, the time. We're going to pull it together to promote some other services, and definitely have our digital champions on hand to help you to actually be more aware of some of the digital services that are out there, and help people set up their NHS app. Following that, our next virtual meeting will be in September, and that will be about access and inclusion and listening to everybody's voice. So next slide, please. So this is just to say a massive thank you to everyone that does take part in this, that feeds back to us. We genuinely want to hear from you and get you more involved with learning more about how the healthcare landscape is changing and moving quite quickly into localities, PCNs, different services that are providing for our patients, maybe at a different site. And so I think over the next 12 months, it's going to be quite interesting. Some people will already be aware of some of those services, but we want to keep you as up to date as possible. Thank you.
Thanks, Maxine and Sushil. So we did have a couple of questions in the chat, and I did try and clarify the first one, which was what was about Bellevue, but Ahmed hasn't replied to that. So I think Bellevue was just one of our practice, it is one of our practice locations. But I suppose if it was about what digital help was on offer there, Maxine, are you able to answer what is available-ish?
Yeah, so all of the services, I think for Bellevue, what's really important is about how we're working with the community pharmacists and some of the local community groups to improve ordering and obtaining repeat medication, because there has been, that is one of our highest areas of complaints, and that is feedback that we've taken and working on. So we have met with our community pharmacists. They are, like I said, actively helping us to promote the system online access, the Voice Connect and the NHS app. We have given them all the information so they're aware of how that can happen, but also not to take away that if patients want to drop in their repeat medication slip to our sites or through the post box, we will still process that for them as well. Rapid Health is used there. We also have other digital apps that are used for physio, some exercises if you're given some telephone advice or seen and examined. So all of those are in use at Bellevue in particular.
And just to clarify on, so if I was a patient and I wanted to go into one of the Birmingham sites and I wanted to be referred to or speak to the digital champion, and I know it's really new, how would I go about doing that?
So they could just call the surgery. It's probably best to pop in and probably from 10 o'clock onwards. So a lot of our reception staff are that they do take messages and they'll say, I'll give you a call back. If they're there in person, they'll go into the waiting room and help them do it there and then. It's quite challenging to do it first thing in the morning because obviously still getting ready for clinics and everything, but throughout the day, no problem. Perfect,
that's good to know. Now there is something, a message in the chat from Michael that says he was given a self for physio. Now you're local to Birmingham, is that some kind of physio external to us? That I don't know what QE.I is. Do you know what that is?
So the QE, I'm assuming they're referencing the Queen Elizabeth, which is one of the main hospitals, which again might be the closest one to Bellevue as well. That would be quite used. I'm suspecting that the self-referral form was a link that was sent from the QE. Yes. Without knowing more about it, it could well be that the patient may not have completed it in its entirety. And so links sometimes only have a set period of time to complete it on, and therefore my suggestion is that they do call the surgery and we can look into it for them.
Yeah, that's a good idea. Thank you. So I haven't got any other questions at the moment. I'm just trying to think if I think it's really good. I think we've done a lot of plugging of the NHS app, which is super important. And I hadn't realised actually the uptake and download of it was that high now across the country, which is really good to understand and reassuring. So it is super easy to order your prescriptions, much easier than travelling and dropping your paper off if you can. So if you've got it, please do use that. But again, we want to emphasise that if you can't use digital, either you can come and get help to learn how to use it if you'd like to, but if you can't, and there's lots of reasons why people can't at times, the team is there to help and guide you through the process of either getting an appointment or getting advice on learning anything. Is there anything else, Sushila, you'd like to add? Because you're obviously at the other end of it, looking at some of the online forms that come through.
Yeah, I mean, what I wanted to say is the whole idea of rapid health is sometimes, you can't get all the information on the phone when you're trying to book an appointment. And the more information, the more accurate information that a clinician we get, the right place we can book you in, because sometimes we also have MSKs, which are physiotherapists in-house. And sometimes I feel like, this will be best booked in with the MSK practitioner. But because the information may not be accurate, then they get booked in with the doctor and then again get referred on, so because NHS, we have to admit, it's amazing when it works well, but we are very limited with our resources. So we're here at the end of the day for everyone, for the patients. So we just want to make sure that we're accessible and we're giving out the right appointments for the right conditions. So because like as I mentioned before, sometimes I have to pick up the phone and ask a question and realize it was something totally different. And then that appointment's a bit wasted, So let's try to give as much information that we can, because rapid health is really good in the sense that if it feels that, okay, we can just send you a link, then you can decide what time you book it yourself. The other thing I want to mention, which I know Maxine has mentioned, is AccuRx, which is that text link that we send out. And then patients send in photos, and which has been really helpful because you don't have to come into the surgery, wait to be seen, park and everything, and then suddenly just to show one small rash. Now you can do that all by taking photos. Again, it's not suitable for everyone, but for those who it works for, it's brilliant. So looking into that. And we recently have sent a few texts out as well, asking for blood pressures and a few other things. Again, if you have that information, send that in. It is very useful for us to make sure that everything is going right. But thank you. And like at the end of the day, feedback is amazing, whether it's good or bad feedback as well. That's how we learn and that's how we improve for the service for everyone. Thank you.
That's great. Thanks, Sushila. Maxine, anything else you want to add?
No, I don't think so. I think I just want to say that actually all of the services that we've mentioned today are all accessible. All of our teams are aware of what we use it for. Please continue to ask. If it happens to be at a busy time when you call in, especially around rapid health, we will call you back. They will say that we'll call you back and they'll give you an approximate time to help you fill in the form over the phone as well.
That's brilliant. Thanks, Maxine. Well, they haven't got any more questions, so I think we can probably wrap up there. And then just a bit of a plug that more information will come out for the summer, sort of June, July, in practice or in a community location, and when you can physically come along and come to a nice community event and meet some of the practice team and some other services as well. So thanks, Maxine. Thanks, Sushila. Thanks, Abby, that's off screen. And we'll see you all again soon. Thanks. Bye.
Thank you.